Good morning, Chairman, Co-Chairman, and colleagues. I would like to present objective evaluation of scat collapse test in cubital tunnel syndrome. My name is Isarapong Duangmee. My advisor, Dr. Detporn Puthiwara. The cubital tunnel syndrome is second most common nerve compression. Diagnosis based on history and physical examination. The electrodiagnosis study is gold standard for confirmed diagnosis. Dr. Cheng proposed an article called Scat Collapse Test in Journal Hand Surgery in 2008. The sensitivity for cubital tunnel syndrome was 69% and accuracy was 89%. And from Journal Hand in 2010, Scat Collapse Test was performed by Dr. Christian. It was proposed that primary compression site of ulnar nerve is Osborne band. The scat collapse test may be a reliable physical examination technique to diagnose cubital tunnel syndrome. Do you believe it or not? Previous study is subjective test may have information bias from examiner. So purpose of this study is to evaluate scat collapse test in terms of objective test for diagnosis cubital tunnel syndrome. Our hypothesis is scat collapse test may be a reliable physical examination technique for diagnosis cubital tunnel syndrome. Inclusion criteria are patients who were diagnosed as cubital tunnel syndrome and confirmed by electrodiagnosis study from November in 2016 to June in 2018. Then we exclude patients who have the cervical disc or the nerve root disease, previous surgery or normal nerve conduction. For the control group, we conduct from officers in our institute who did not have the symptom and was not performed the electrodiagnosis study. Let me introduce to how to test the scat collapse test. The patient was facing the examiner with the arm adduction. The elbow was flexioned about 90 degrees, hand outstretched with the wrist neutral position. The body was attached to the wall. Step A. The patient was asked to perform shoulder external rotation against the dynamometer, keeping the arm adducted by the Velcro strap. Step B. The examiner scratched with the fingertip over the cubital tunnel at the elbow. Step C. Immediately afterward, step A is repeated. Every participant underwent the test 3 times. Positive scat collapse test was recorded if patient demonstrated that loss of the shoulder external rotation power on the affected side after scratching over the cubital tunnel. So result we categorize in 3 scenarios. Scenario A, the positive is the positive every time. Scenario B, positive at least 1 time. And scenario C, positive at least 2 times. So we have the 16 patients and 20 in the control group. From scat collapse test, we categorize in 3 scenarios as I mentioned. For scenario A, there was positive in 3 patients. For scenario B, there was positive in 10 patients, and we have the 6 patients in scenario C. So we calculate the sensitivity and specificity. In the scenario A, sensitivity was 19% and specificity was 100%. If there is in the scenario B, sensitivity was 63% and specificity was 50%. In scenario C, sensitivity was 38% and specificity was 75%. So the scat collapse test is the provocative test to diagnose the cubital tunnel syndrome. Dr. Cheng et al. Proposed the sensitivity was 69% and specificity was 99% and 89% of the accuracy for diagnosis cubital tunnel syndrome. There is a bias from the examiner due to this is a subjective evaluation. Our study is object to the evaluated the scat collapse test by dynamometer. There are wide range of the sensitivity and the specificity. Range of sensitivity were from 19 to 63%, and range of the specificity were from 50 to 100%. The strength of our study are objective measurement, no bias from examiner, and we have the sensitivity analysis. Our limitation is small sample size, so we conclude that the scat collapse test might be not appropriate modality to detect cubital tunnel syndrome. Further study with the large sample size are our suggestion. Thank you.